demonstrate placing a needle on the syringe, reconstituting powdered medication, changing the needle out, and drawing up medication from a vial. And I'm going to follow standard precautions. Remove your cap. So remove my cap from my powder, and then from my liquid vial. And then you will use an alcohol prep pad to clean the surface of them. So, and then I would use another alcohol prep wipe and clean the surface of the other one. And then you want to grab your syringe. Here's my syringe. And then your needle. So I will go ahead and place my syringe. And then here is that. Now I have the cap in my non-dominant hand, and I'm going to draw air equal to the amount of medication to be withdrawn from the vial. And now I'm going to insert the needle into the diluent at a 45 to 60 angle. And then while pushing it, you go upright to a 90-degree angle. And then inject the air. After I have injected the air, I'm now going to invert the vial, and I'm going to withdraw the medication slowly. And if you have any air bubbles, you would stabilize the vial and use your index finger and firmly tap below the air bubbles, or if it is at the hub of the syringe, you would push back in any air. And now you would remove it. At eye level to make sure that you have drawn up the right amount of medication. And I'm going to proceed by injecting the diluent into the powder, and I have wiped it with the alcohol prep wipe. So the diluent has been mixed into the powder, and I have mixed it by rolling it. You do not shake it. And here's that. I'm going to reinsert the needle, and I'm going to withdraw the reconstituted medication into the syringe. I have withdrawn the reconstituted medication. I am now going to recap the needle. And now I am going to replace it with a sterile needle before injection. And here is that. And then I will hold the syringe vertically and eject any air. If necessary, hold the syringe horizontally to eject unneeded medication from the syringe to reach the prescribed dose. I am going to administer an intradermal medication. I'm going to follow standard precautions. I'm going to identify the patient, use hand hygiene. I'm going to provide safety, privacy, body mechanics, document at the end, and identify any patient allergies. So I'm going to draw up the medication from the vial. And then I am now going to select the site for injection. The usual sites are the ventral surface of the forearm, the upper back, or the upper chest. I'm going to assist the patient into a comfortable position. In this case, we're going to use the forearm, so the patient is going to extend their arm and supinate it on a flat surface. And then I'm going to don on procedure gloves. If using the upper back, I will instruct the patient to lie in a prone position or to lean forward over a table or the back of a chair. So I'm cleaning the injection site. And now I'm going to hold the syringe between the thumb and the index finger. With the syringe in my dominant hand, I'm going to bevel up and parallel to the patient's skin at a 5 to 15 degree angle. So here I am holding the patient's skin tone, and I'm going to insert the needle slowly. So a 5 degree, and I'm going to advance approximately 3 millimeters. After you have inserted the injection, you should be able to see a pale wheel 6 millimeters to 10 millimeters in diameter, and it should appear over the needle bevel. And then I'm going to remove the needle from the skin. Okay, and then I'm going to cap it, and I'm going to dispose of it in the biohazard waste. I'm going to blot the injection site. So you are going to use a pen to draw a 1-inch circle around the blapper wheel. I'm going to administer a subcutaneous medication. I'm going to make sure to use standard precautions. I'm going to wash my hands. I'm going to identify the patient, provide privacy, ask about any allergies, use body mechanics, and document at the end. You're going to select the appropriate syringe and needle. Consider the amount of adipose tissue. So for insulin, we're going to use you typically use a 0.3, 0.5, or a 1.0 milliliter. Most insulin needles are 28 to 31 gauge, and the needle length is often 3.3/16 to 1 inch. So we are going to draw up the medication. And now we're going to select an appropriate site, and the sites are the outer aspect of the arm, the abdomen, 2 inches away from the umbilicus, the anterior aspect of the thigh, or high on the buttocks near waist level. Just make sure that it has adequate subcutaneous tissue. We're going to position the patient so the injection site is accessible. We're going to don on procedure gloves. I'm going to grab my alcohol prep wipe and clean the injection site. I'm going to allow it to dry before I insert the needle. I'm going to check the site for any lumps, swelling, bruising. So I'm going to uncap the needle. Between my thumb and index finger, I'm going to hold the syringe. With my non-dominant hand, I'm going to pinch the skin, and I'm going to use a 45 to 90 degree angle. I'm going to hold the syringe like a pencil or dart. So I'm pinching the site, I'm inserting it, and then I'm going to pull up smoothly, and then I'm going to cap the needle, and I'm going to dispose of it in the biohazard waste. I'm going to blot the site. I'm going to remove my gloves. I'm going to place the patient in a safe, comfortable position. I'm going to put the call light within reach of them, and I'm going to document. In this procedure, I'm going to demonstrate intramuscular injection. There are 3 sites. The ventral gluteal site is located on the lateral hip. It involves the gluteus medius and the gluteus minimus. The deltoid site is located on the upper part of the arm, and the vastus lateralis site is located on the anterior lateral thigh. For this procedure, we are going to use the ventral gluteal site. The first thing you want to do is grab an alcohol prep pad, and you're going to wipe the vial. You want to grab a 1 to 3 milliliter syringe and a 21 to 25 gauge needle, which is 1 to 1.5 inches for adults. We are going to draw up the amount of medication that is prescribed. We are now going to draw up the medication. After you have drawn up the medication, now you're going to verify the dose. You will don on procedure gloves. We are going to position the patient so the injection site is well exposed and the patient is able to relax their muscles. And for the ventral gluteal site, we're positioning the patient on the side with the upper hip and the knee slightly flexed. So we are going to use appropriate landmarks and identify those appropriately. Alright. And then after we have identified appropriate landmarks, we are going to take an alcohol prep wipe and we are going to clean the injection site. So I'm cleaning the injection site, and then you want to place the corner of the pad pointing towards the injection site so you know where that needle goes. And now after the site has dried, I'm going to remove the cap of the needle. I'm going to tell the patient that he will feel a prick. And then I will hold this syringe like a pencil or a dart between the thumb and the fingers. And I will insert the needle at a 90-degree angle. And I will insert it fully. So here I go. The 90-degree angle. And then I would aspirate for blood. And there's no blood, so I continue. So after all the medication has been injected, you are going to remove the needle smoothly. And you are going to dispose of this in the biohazard waste. You're going to use, you're going to gently blot the site with a gauze pad. And you're going to apply a bandage if needed. Where I'm going to watch for adverse reactions at the site. I'm going to reassess in 10 to 30 minutes. I will now remove my gloves. And I will put the patient in a comfortable position. I will give them their call light. I will ask them if they have any questions, and I will document.